When I started as a physical therapist, I remember spending most of my evaluation sessions testing. As a student, I'd spend hours learning all the special tests and go through all of them with the patient as they look confused while I'm putting their body in these weird positions and pushing on them in different directions. I think as I've gotten older, I've become much more selective with my special tests. For me, I look at special tests now as something to use if it's actually going to change my plan of care or decision making. Now, don't get me wrong, there's certainly a need for special tests in many circumstances, but now I usually prefer to use the test-retest approach, where if I have a hypothesis around what's going on, I'll test the patient, usually to elicit their symptoms or pain, do some treatment around what I think would help, and then retest that patient again in a similar situation. If the patient feels better, it's a good sign that we're on the right track, and I should keep driving down that road. If they feel the same or worse, then I know that perhaps I might need to veer off and try something else. And with experience, this has become a way more efficient approach for me and for my patient, because it allows them to experience positive changes faster, as well as generate buy-in that we're on the right track. You see, if a patient actually feels better during the time that they're in the evaluation, it's more likely that they're going to see the benefit of physical therapy. And so oftentimes this has been my new approach, rather than spend most of my time testing and then not really eliciting any real positive change to begin with.